Before this inquiry, we thought of learning support mostly through systems, strategies, assessments, and interventions, but this was not working effectively for some of our Konga. But Pongarosa challenged us to think differently. Here, healing and learning do not begin with programs or compliance. They begin with connection.
Equine Therapy is based at Pongarosa in Puni, South Auckland, offers something deeper than an alternative program. Whilst we use the title Pongarosa, this is the physical name and address where the Halo program takes place. Through the Halo program, human-assisted learning organization, young people and people of all ages learn to connect safely with horses in a non-riding, ground-based environment. The work is relational, sensory, experiential, and profoundly human.
Listening to community voices from the director and an experienced RTLB who know equine therapy well changed our understanding of what meaningful support can look like. We learnt and saw how horses model trust, calmness, emotional regulation, and non-judgment. We learned that some Konga who struggle within classrooms can thrive in spaces where they feel safe, seen, and connected. This supported and reinforced our beliefs and assumptions about where learning happens, and who holds knowledge. Equine therapy reminded us that communities already hold powerful expertise which we need to utilize and walk beside them through our support. Our role as RTLB is not always to lead, but to listen and walk alongside those we are connecting with.
This inquiry also raised important tensions. Systems often prioritize measurable outcomes, standardization, and behavior management. Yet the healing we witnessed at equine therapy was relational, slow, sensory, and non-linear. It made us question whether current systems fully recognize the kinds of learning that many vulnerable Konga actually need. We also reflected critically on access. We also began to reflect on the importance of creating sustainable financial support pathways, so that Konga and their whānau can access the valuable taonga that already exists within our community. If spaces like equine therapy are transformative, who gets access to them? And who misses out?
This storying journey has changed how we think about our practice and how we can make it evolve further. We now understand more deeply that behavior is communication, that connection comes before learning, and that well-being must sit at the center of support. Going forward, we will advocate more strongly for holistic and community-based approaches, value lived experience alongside professional knowledge, and continue building relationships beyond traditional educational spaces. Equine therapy reminded us that healing often happens not through fixing people, but through walking beside them.
Perhaps the greatest learning from this inquiry is that the most powerful support does not always come from systems. Sometimes it comes from presence, from trust, from the community, from nature, and from spaces like equine therapy at Pongarosa, where young people are surrounded by a halo of connection, healing, and possibility.
Sonia Morse Equine Therapy Program at Pongarosa represents Ngā Mahi Punamu o Te Hapori, a precious community taonga offering authentic, relational, and holistic support for Konga experiencing trauma, anxiety, neurodiversity, and emotional challenges. As RTLB, this inquiry reinforced how meaningful learning, regulation, connection, and well-being can emerge through safe, sensory-rich experiences beyond traditional educational settings.